a lot of people don't feel bad when eating gluten, but then if they take a break from it and they cheat, like let's say they avoid it for a month and they're like, oh, I'm going to just bring it back. And then they react and they're like, hey, what happened? I was always able to eat it. And now it was like a shock to their system, reintroducing it. To me, that's not a bad thing. It's good that their body told them that, hey, at least for now, take a break from it. Whether or not they could reintroduce it again later, again, that really does depend on the person.
Thank you so much for joining us on another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner. And this episode is brought to you today by Nikki, Unleash the Wellness Within. It's a wearable device, non-invasive, easily affordable, and highly effective approach to optimize wellness. It puts frequency better based life in your hands and on your wrist. Make sure to stick to the very end because we have a wonderful giveaway. You're not going to want to miss out. But as usual, you're not going to want to miss out on one word my next guest has to say because he is just a plethora of amazing knowledge all about the thyroid, autoimmune, and so many things that have to do with, more of the holistic side of healthcare. So without further ado, let's welcome my friend, the amazing Dr. Eric.
Yeah, thank you, Heather. Appreciate you having me. Very excited to be here.
Absolutely, absolutely. There's so many, I've met so many amazing practitioners in this field, but there's very few of them that are so heart-centered and humble like yourself. Like you have truly been a really awesome friend, and it's been awesome to get to know you over the past year. And I'm blessed to be here with you today. So I appreciate you.
Well, thank you. Feeling is mutual.
Ah, so tell us a little bit about yourself. How did you get started in the field of, why do you want to become a doctor? And how come you're talking about thyroidism? And, I'm feeling like maybe there's a pain to purpose story or maybe not. But yeah, tell us a little bit about yourself.
Yeah, so my background's a doctor of chiropractic, and I became a chiropractor because I hurt my lower back when I was younger and just found out the benefits of chiropractic and just had a regular chiropractic practice for 7.5 years. And so I had my low back journey, which was actually very short, only a few months before I got that fixed. But then years later, I was diagnosed with hyperthyroidism, eventually Graves' disease, which was definitely a longer journey than my low back issue. And at that time, when I when I was practicing chiropractic, whenever I attended my continuing education credits seminars associated with that, they were always nutrition or functional medicine seminars, and a few of them were functional endocrinology seminars. Little did I know that I would need to use them for myself because honestly, even though I attended them, I'd never really helped people with thyroid conditions. I was my first thyroid patient. This was back in 2008, and I was not sure whether or not a natural approach would work, but the alternatives when it comes to hyperthyroidism, it's pretty much take anti-thyroid medication for a long time or get radioactive iodine, which is get your thyroid gland obliterated, or get your thyroid gland removed via surgery. And so I didn't like any of those options. So I, of course, decided to take a natural treatment approach, and it did wonders for me, was able to restore my health. And since 2009, I've been helping other people with hyperthyroidism as well as Hashimoto's. But since my experience is with hyperthyroidism and Graves, I do see a lot more people with hyperthyroidism just because of my background and experience.
Man, 2008, you're like an OG in that field. Like there was not a whole lot of people talking about that stuff back then, but it's so sad to me that when we do get diagnosed, like when I got diagnosed with Hashimoto's, the regular conventional medicine is just like, yep, take this, medication for the rest of your life. There's nothing you can do about it. And
Yep.
I, like you, was like, yeah, watch me. Within 6 months, I had reversed my Hashimoto's, so
Awesome.
it's crazy how dogmatic that field still can be, and then there's no way out, and so thank God for functional medicine and people like you going, no, there is a way, there is a way. So what are some of the other things that you're seeing kind of in connection with the thyroid issues and functional health? And you said it took a little longer than your back journey. How long did it take?
It took, I mean, once I started incorporating the diet and lifestyle changes and, take some supplements and, uh, I mean, prior to that, I did some functional medicine testing as well, some adrenal testing. And I mean, the testing does depend on the person, and at least in my practice. But I mean, for me, it took about 9 months before everything was in range. Now, for some people, it could be a longer process. It really, again, it depends on the person. And there is a time and place for anti-thyroid medication. So I'm not just like there's a time and place for thyroid hormone replacement in Hashimoto's, but well, I agree. I think it's crazy that most endocrinologists, that's their solution. It just take the thyroid hormone or just take the medication or just take the whole thyroid out. And that's their solution. But I mean, there are a number of factors. I mean, in my case, stress was a big factor and big factor with a lot of people with these autoimmune conditions. But it's not just emotional stressors. It was also physical stressors. I was overtraining. I wasn't listening to my body. And I think that, I don't think, I know that was a contributing factor when it comes to the development of at least my condition. But again, over the years, I've had a lot of patients on their health history forms just put stress as on a scale of 1 to 10, like a 10 or an 8 or a 9. And even when they don't put that, I think that they might be in denial like I was, because when I dealt with Graves, I knew stress was a fact. Well, it's not like I didn't deal with stress, but I thought I did a good job of handling stress just naturally. But then when I saw my adrenal results, which everything was low, low cortisol, low DHEA, low secretory IgA, everything was depressed. And so I kind of needed that test to convince myself that, yeah, I wasn't an expert when it comes to handling stress.
So one thing that's worried me a little bit about everything that's gone on in my life in the last, well, for the last 4 months, knowing what I know about stress, and sometimes life just throws things at you that it's not avoidable, right? So
Yeah.
thank God for some of the tools that I've learned, especially around like somatic work and breath work and other things to kind of help deal with stress. And then the lifestyle, of course, and diet and removing toxins. But yeah, I've been a little worried over the past month, especially to this move to Mexico. I'm like, oh, I know what stress does to the body. Like, what am I in for in the next 3 months when my body does calm down, and decide to shake loose whatever it's going to shake loose. So we're going to actually take a break. When we come back, I want to dive into some of your natural approaches to dealing with some of these things. So yeah, don't go anywhere. Stay tuned. We'll be right back.
Nikki Wellness Technology. Delivering frequency enhanced health.
It looks like a little watch, but it's actually a frequency device. It's bioenergetic, so it has this little frequency light situation that goes into your arm.
This is my Nikki. It is a bioenergetic wearable that works by emitting a specific frequency carried by a red light, as you can see on the back. It's aimed at enhancing the body's natural healing process to improve wellness and reducing stress, pain, and inflammation. And to select a frequency, you tap it to wake it up, and then you slide to the screens that list the different frequencies. I have wellness or Lyme on mine. So if we want to pick one, we just tap on it, and you'll see the circles around, and there's a play button, play areas, tap there, and you can see the colors radiating that show that it's playing. And you would also see the red light on the back. And to stop, you just tap it again, and then you can slide and select a different frequency. I'm going to play afternoon. And you just tap, and away you go for your afternoon.
So they're two different things. You have the Nikki device, and then you have the frequency sets. And so right now they have the wellness set of frequencies and they have the Lyme set of frequencies, and both of them are absolutely incredible. I use both sets on a regular basis, so I absolutely love them.
Nikki Wellness Technology. Delivering frequency enhanced health. We are Nikki.com.
Woo! Welcome back. I know. Are you on the edge of your seat like I am? Like, what can we do, Dr. Eric, to help, reverse some of these things? So I'd love to hear some of your approaches to dealing with Hashimoto's, Graves, autoimmune, hyperthyroidism?
Well, I mean, you want to start with the foundations. I think everybody should start with the foundations, diet, of course, and the $1 million question. Well, what diet should I follow? And it's different. I mean, I know people want to have that specific diet, and I do like autoimmune paleo and paleo diets. And I mean, some people follow modified paleo, but I have a book, The Hyperthyroid Healing Diet, and it has different diets in there. It's not just one single diet because again, there's not one diet that fits everyone perfectly. But I think we, as functional medicine practitioners, we all agree you want to eat whole, healthy foods, avoid the refined foods and sugars. Do recommend avoiding common allergens while at least while healing, like gluten and dairy. Usually recommend going grain-free again while healing. So again, diet is important, and it's not. I mean, there's a lot of people that clean up their diet and get great results. There are also people who clean up their diet and they're like, you know what? I don't feel much better, even though I'm eating a pretty healthy diet. And that usually means there's other things. I mean, diet is one component, it's one piece of the puzzle. But just if someone that's all they do is avoid gluten and dairy and other potentially inflammatory foods and they're not feeling better, again, that's where we need to look into stress and make sure they're blocking out time on a regular basis for stress management. Like you said, in your situation, it's just been very stressful over the last month. And a lot of people are in that continuous state of being stressed out. And a lot of times we can't do anything to eliminate the stressor. So we need to do things to improve our stress handling skills, whether it's just incorporating mind body medicine, or as you mentioned, there are so many now devices, apps and other things that we could use. Uh,
Well,
you know,
even
to,
on our Nikki, we got stress and
yeah,
anxiety, and we got emotions. And I swear I've been burning that one out. It's
there
so
you go.
my best friend lately. Oh my gosh.
Yeah, so yeah, there's yeah, you're right. So there's the Nikki. Again, there's a lot if you don't want to just incorporate just deep breathing, meditation, things like that. Yeah, you could rely on that, or at least use the technology in combination with those. Getting proper sleep. Sometimes it's easier said than done, but if you're only sleeping 4 or 5 hours a night, or some people less than that, it's really going to be difficult to restore your health. So again, the diet, the stress management, getting proper sleep. Uh, our toxic environments is just a big factor in the prevalence of not only autoimmune conditions like Graves and Hashimoto's, but other chronic health conditions. And it's not just the impact that these toxins have on our immune system, but many of these are also endocrine disrupting chemicals. And so things like, I just probably like you, just telling people not to drink out of plastic bottles, and people get sick of that. But again, it's not just, I mean, it's based a lot of research out there. It's just not us
You
crazy
know
functional
how
medicine
many
practitioners.
people, though, like other practitioners that I am doing this podcast with, and they will pick up a freaking plastic bottle and take a swig out of it. And then, of course, I have to call them on it because I was like, dude, what are you doing? And
Yeah.
it's pretty prevalent here in Mexico too. Like, I mean, the
Mhm.
plastic water bottles everywhere. I'm kind of shocked at how much plastic is around here, being so close to the ocean. When I was living in Hawaii, they seem to be a little bit more, cognizant of the effect of plastic in the environment. So it's different. But yeah, my backpack's heavy because I'm usually carrying around both my stainless steel
Yeah.
water bottles with
Yeah.
me
Same here.
everywhere.
Yeah.
Yeah, along with my RO. My freaking
Yeah.
my luggage was so heavy because one of them had my air filter and the other one had my RO unit.
Mm. Yeah, wow. Yeah. You're doing great. So yeah, that's one simple change. I mean, obviously there are other sources of plastics, but you're right. I mean, if someone is buying plastic water bottles by the case and that's their main water source, I mean, just the impact that it'll have on the thyroid and other hormones in your body, it could be quite dramatic. So if someone's like gaining a lot of weight, it might be like, hey, my diet is perfect, but I'm drinking out of plastic water bottles and getting all these other exposures when it comes to plastic. So again, yeah, I don't want to harp on the plastic, but that's a change that many people can easily make. Just purchase a reverse osmosis system. They're not that expensive. It's not like you have to spend thousands of dollars on a good RO system. But yeah, our toxic environment as well, just also like cleaners, cosmetics that we use in our home. I mean, do as much as you can inside your home, because once you step out of your home, there's only so much you could do. But in your home, there's a lot you can do. But the infections a big factor with a lot of people. So of course you're the expert when it comes to Lyme disease and other co-infections and viruses and gut infections like H. pylori, parasites. I mean, again, these are things that just about all conventional medical doctors overlook, and they also go just by symptoms. I don't know about your experience with Lyme, but when I dealt with chronic Lyme, I didn't have the typical classic Lyme symptoms. Mine were more neurological. So when I asked for a Lyme test, the medical doctor was like, no, you don't have Lyme. There was no evidence of a bullseye rash or tick bite. My symptoms are more neurological. And he's like, no, you don't have Lyme. And 3 days later, 3 days later, I got the test, but it took me a couple of weeks to get back that test before that confirmed I not only had Lyme, but also had Bartonella. But you can't always go by symptoms. I mean, regardless of, the infection that you might have. H. pylori is another example. And again, there's controversy. Is H. pylori a problem with everybody? And I mean, we could get into that conversation, but the point is, just because you don't have heartburn or reflux doesn't mean it can't be an issue. I'm not saying it's an issue or a trigger in everybody, but again, it's something that's typically overlooked by medical doctors unless if someone is having those classic symptoms.
Oh, absolutely. And it's so funny too, recently single and knowing what I know about people. And I'm like, God, if half the population has H. pylori and it's, easily transmitted through saliva, so just kissing or sharing somebody's drink. And I'm just like, and then what I know about parasites, and I'm just like, that's it. I'm just going to stay single. I'm not dating. People have cooties and I don't want them. But no, let's go back to the diet thing, because you said something that actually kind of perked my interest. You're like, while you're healing. So what are your thoughts on being able to reintroduce some of those inflammatory foods afterwards? Or are you kind of a abstinence for life type of person?
No, I'm not an absent for life with all the foods that I recommend avoiding. It's just to me like, for example, AIP or even paleo, they're more like elimination diets. I mean, paleo diet we could live on, and I kind of eat more of a kind of a modified paleo diet on a regular basis. Not to say I never indulge and stray outside. That's why I say modified paleo diet and not 100% strict paleo diet. But yeah, like for example, dairy. I can't say I never consume dairy. I kid around how when I have pizza, I have a cauliflower crust pizza, but I want my mozzarella cheese. I don't want like the vegan cheese on the pizza. Uh,
Well, you sound like you've got an East Coast accent, so the mozzarella would be very important to you.
yes, definitely very, very important
Kind of
to
like
have
me
my
in
mozzarella.
Mexico right now. I'm part Mexican and I can't get away from the corn. It's been
Hmm.
actually easy to get away from the dairy. I still haven't had dairy since I've been here, but I've had corn every single
Hmm.
day since I've been here. And thank God Mexico is one of those countries that have actually kind of outlawed GMOs. So I don't have to
Oh
worry
wow.
about
Yeah.
that. But yeah, years ago, I've been years without eating grains or corn. And so I was a little like, what's gonna happen to me? But so far, so good.
Yeah, so yeah, and it depends on the person. So yeah, I can't say I never have GMO-free corn, taco, corn-based taco. It's or chips, corn-based chips. Again, it's eh, if someone reacts to it, I mean, there are some people that do need to, like, if they don't do well with dairy and not just lactose intolerant, but some people just besides that, they just don't do well. Maybe they should avoid dairy permanently. Gluten is definitely more controversial. I mean, gluten, I mean, in a perfect world, I'd say, yeah, let's just eliminate it completely. And I do try my best to avoid it, but there are some people that seem to where they can get away with it after I mean, some people arguably even while they're healing, but if they're eating it while they're healing, it's not because I'm giving them permission to do it. It's because they're just doing it
Right.
on their own. But there is the question, well, can I reintroduce healthier forms of gluten? Like, can I have like Ezekiel bread or sprouted wheats that, is organic? And
Sourdough.
yeah, exactly. And again, I do think it comes down to the person. I can't say that every single person 100% should avoid gluten. I mean, there is research suggesting that it does increase permeability of the gut in everybody. Um, but again, I don't think there's been research. I could be wrong, but I don't think the research has been done on like Ezekiel bread or sprouted organic bread or sourdough bread. But then there are some studies showing with celiac sufferers, like some of the earliest studies suggested that maybe people with celiac disease can tolerate and eat sourdough bread, but more recent studies seem to say that's not the case. But not sure if it's really because of that increase in the permeability or just because it causes that immune system reaction. I think it's more of the latter with the celiac patients. But yeah, um, yeah, like I said, I do try. I can't say I 100% have avoided gluten for, the past 15 plus years, but for the most part I do. With gluten, again, I don't feel bad when I eat it, which is kind of good and bad. It's good, I guess, because I don't feel bad, but sometimes in a way I think it's good because it's not, because again, if someone is, especially when they're healing, and if they decide to have some gluten and they're not feeling bad, then they think it's okay because they're not getting the symptoms. But again, it could be increasing permeability, which doesn't always present with symptoms.
Absolutely. I kind of loved it when I was in practice, and my clients would screw up and never failed. Usually it's around month, 1.5, so they're doing so good. They're actually starting to feel better and they have a slip up. Something happens and then they immediately have a reaction afterwards. And so I love it because first off, they're like, oh, I did this, like confessional. I'm like, I'm not a priest. Like, you don't have to confess to me. It's okay. But your body's going to keep you in check, right? Like, what better way? Because unfortunately, most of us are so inflamed that they can't feel our body's triggers, right? Because we're so inflamed. And then once some of that inflammation goes down, now they're starting to get an appropriate response to things and they're starting to see the cause and effect. And so I think it's awesome when they cheat.
Yeah, and you bring up a good point because you mentioned like how we're so inflamed. So a lot of people don't feel bad when eating gluten, but then if they take a break from it and they cheat, like let's say they avoid it for a month and they're like, oh, I'm going to just bring it back. And then they react and they're like, hey, what happened? I was always able to eat it, but now, and it could be with dairy, the same thing with dairy. They took a break from it, reintroduced it, but it's because that inflammation decreased. And now it was like a shock to their system, reintroducing it. To me, that's not a bad thing. It's good that their body told them that, hey, at least for now, take a break from it. Whether or not they could reintroduce it again later and eat it on a day in, day out basis, or maybe occasional basis, again, that really does depend on the person.
Absolutely, absolutely. So we're almost getting close to time here. Can you give us like one more nugget that somebody can, start to implement today, that would help with their thyroid issues or autoimmune?
Yeah, I mean, even though I mentioned the foundations, just there is a time and place for supplementation. So don't want to like rattle off like a whole list of things, but a few important ones. Selenium is extremely important and very beneficial I mean, just overall, but especially in thyroid health. A number of studies showing that selenium could help with lowering thyroid antibodies. So with both those with Graves and Hashimoto's. And I mean, you could get selenium from Brazil nuts. The thing is with Brazil nuts, like I eat Brazil nuts on a regular basis, but you just don't know how much selenium is in a Brazil nut. So while someone is healing, I usually do recommend supplementation so I know exactly how much selenium they're getting. So selenium would be one to maybe consider incorporating, or if you're working with a practitioner, which of course we're going to recommend because we're biased and recommend that people not self-treat themselves, but selenium is great. A lot of people are deficient in omega 3s. So if you're not eating fish at least 3 times a week, I would say you probably could benefit from an omega 3, like a fish oil. Vitamin D, Most people are deficient, even I'm sure a lot of people in Mexico. And there's a reason for that. I mean, if you're getting sun regularly, if you're out there sunbathing, you might be good. But I find in at least like, I don't know, Mexico, but places like Arizona, Florida, a lot of people stay indoors when it's really hot, so they're not getting regular sun exposure. And of course, a number of people are also using sunscreen and stuff like that. Again, if someone is sunbathing for 20 minutes a day or something like that, again, maybe they don't need vitamin D, but the only way really to know is by testing. So vitamin D, I wouldn't recommend just randomly take vitamin D. I would say test. And then if you're deficient and you want to try to bring it up through sunlight, so be it. You know, you could definitely try that. But yeah, so what I'm getting at is deficiencies, and those are things that you could do definitely through diet to some extent, but there is a time and place for supplementation.
Oh, absolutely. And actually, before we go, I wanted to hit on one other point. When we were talking about water and drinking out of plastic, most people don't consider the water they're bathing in. Tell us a little bit about the correlation between chlorine, fluoride, and thyroid health.
Yeah, great question. Yeah, I mean chlorine, fluoride, so you have iodine, which again another controversial topic in the world of thyroid health, but we know that iodine is important for thyroid hormone formation. You can't form thyroid hormone without iodine, and then but there are other halides, fluoride, chlorine, bromide that all compete with iodine, and so yeah, if you're when you're bathing or if you're drinking tap water, you're getting exposed to chlorine, which again, so that could compete with iodine, and then fluoride from also unfiltered water, and if it depends on the filter, reverse osmosis takes it out, but not all water filters will remove fluoride. Then obviously there's toothpaste, fluoridated toothpaste as well. So I'm sure like myself, you probably use fluoride-free toothpaste. And yeah, so I mean, great point with the toothpaste. It's easy enough to get one that's fluoride free. With with bathing, it's a little bit more challenging. I think it is more risky to swallow it. So another reason not to drink tap water, and and again, the bottled water. If you're buying bottled like plastic water bottle, again, it might get rid of the fluoride, but we're concerned about the xenoestrogens in the plastics. I mean, honestly, the shower. There are whole house filters. There are you could just get shower filters. Most of them do a really good job of reducing chlorine. Fluoride, maybe not as much, but the chlorine alone is worth getting a really good shower filter. And yeah, and that's what we have. We actually had, I actually purchased a whole house filter, but they had to like dig up the concrete, and my wife like shut it down. She's like, "No, we're not doing the whole house filter though," because of what they had to do. Like we had two different plumbers, like say, just I guess the setup of our house. So, and it was a big thing we had to return. It was like really big whole house filter. So we just got individual shower filters. The downside of that is if one of us wants to take a bath, it's not filtering it out. So that's the
I
advantage of the
got a
whole.
shower head that comes off. And so when I take the shower head off and I just let it dangle, and then I fill up the bathtub with my shower head.
That's cool. We have at least one of our showers is like a typical shower bath combo, but the other one, like in our main room, it's separated. So you have the shower
Oh,
and then the
gotcha.
bath, so you can't, yeah.
Gotcha, gotcha. You got one of those big fancy bathtubs. Yeah, here in Mexico, I don't have a bathtub at all, which makes me super sad. But I don't know if I
Uh,
want to bathe in the water here.
yeah, good point. Yeah.
All right, we're getting to the end. This is the shameless plug time of the show. So, Dr. E, how can people find out more about you and how about, the thyroid and healing and all that fun stuff?
Yeah, so my podcast, which you've been a guest on, so Save My Thyroid, and definitely listen to my interview interviewing Heather, and yeah, so SaveMyThyroid.com, or you can just visit your favorite podcast platform and type in Save My Thyroid. Have three thyroid related books which you could check out by just visiting Amazon and just type in my name, Eric Osansky. and 2 on hyperthyroidism, 1 on Hashimoto's called Hashimoto's Triggers. And also have a newsletter, savemythyroid.com/newsletter. And the name of the newsletter is Healthy Gut, Healthy Thyroid. And that's one thing we didn't mention here. A healthy gut is important for a healthy immune system, which is important for not just Graves and Hashimoto's, but really I think overall health. We do need optimal gut health.
Absolutely. Thank you
Yeah.
for that. I know I have no idea why I called you Dr. E. It's not like your name is so long it needed to be shortened. I'm still just dealing with a little bit of brain inflammation from stress. So yes,
No
Dr.
worries.
Eric. Awesome. Also make sure to visit wearenikki.com/podcast and enter in BioBeats for 10% off. And because we really love our customers, the way we show appreciation is we give away a Nikki device and a wellness set of frequency on every show. It's a $598 value. So make sure to go to the show notes to enter. Oh my gosh, we've got July's winners. Are you ready? Drum roll. Jackie H, Michelle L, Shelly M, and Jim Heckman. Congratulations. You all won a Nikki frequency generating device as well as a wellness set of frequencies of $598 value. Congratulations. If you didn't win this time, keep listening, keep entering, and keep sharing. Check out Dr. E's stuff. I did it again. Dr. Eric's stuff. And good luck. Join us again next week for Bioenergetics Beat, and have a healthy day. Bye-bye.
Nikki Wellness Technology. Delivering frequency enhanced health.
It's got so many options. I'm just going to go over, it's like a menu that you can choose. It's so easy to use. You just click on what you like. For example, it's got travel, pain relief, energy boost, allergies, trying all the frequencies.
This is my Nikki. It is a bioenergetic wearable that works by emitting a specific frequency carried by a red light, as you can see on the back. It's aimed at enhancing the body's natural healing process to improve wellness and reducing stress, pain, and inflammation. And to select a frequency, you tap it to wake it up, and then you slide to the screens that list the different frequencies. I have wellness or Lyme on mine. So if we want to pick one, we just tap on it, and you'll see the circles around, and there's a play button, play areas, tap there, and you can see the colors radiating that show that it's playing, and you would also see the red light on the back. And to stop, you just tap it again, and then you can slide and select a different frequency. I'm going to play afternoon. And you just tap, and away you go for your afternoon.
So there are two different things. You have the Nikki device, and then you have the frequency sets. And so right now they have the wellness set of frequencies and they have the Lyme set of frequencies, and both of them are absolutely incredible. I use both sets on a regular basis, so I absolutely love them.
Nikki Wellness Technology. Delivering frequency enhanced health. wearenikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of Freemedica. Freemedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.